welcome, and thank you so much for joining today's live Spring Allergy Talk with Dr. Frandsen. And welcome back to those who have been joining our other talks. Dr. Frandsen will discuss how allergies can be tested and treated, what causes allergies, and effective treatment methods. This talk is for informational purposes only, and she will speak in general terms and is not dispensing medical treatment. Participants will have the opportunity to ask questions after the presentation using the raise hand feature. And a bit about Dr. Frandsen before we begin. Dr. Frandsen is a board certified naturopathic physician who received her doctorate in naturopathic medicine with high honors from the University of Bridgeport. She began her collegiate career at Virginia Commonwealth University, where she received a Bachelor's of Science in Biology with a pre-med concentration. Her graduate studies include training in naturopathic medicine, homeopathy, Chinese medicine and acupuncture, physical medicine, botanical medicine, and counseling. And her postgraduate experience includes ART certification through the Klinghardt Academy. Dr. Frandsen's area of focuses include allergies, environmental medicine and chemical sensitivities, herbal medicine and homeopathy, anti-aging, weight loss, cancer co-management, heavy metal detoxification, and more. Her philosophy is to use the latest, innovative, most effective methods to bring balance to the body, therefore restoring health while educating the patient on how to maintain it. Dr. Frandsen has helped thousands of patients with allergy relief, and we are very pleased to have her presenting this educational free live talk today for National Integrated Health Associates. I'm going to let her take it away now.
Hey, everybody. I'm Dr. Frandsen. I made a little slideshow here that I'm going to go ahead and share, so I might disappear for a while, but you'll hear my voice. So if you have any questions, please save them till the end. We can use the raise hand feature like she described. But basically, the topic that we're going to cover today is allergies, where they come from and how to get rid of them. I've just wrote up an agenda here. What are allergies? The history and epidemiology, common allergy triggers, less known allergy triggers, treatment options, and then questions at the end. So allergies or allergic diseases, the reason that we call them allergic diseases is because they encompass a lot of various types of illnesses that are related to allergies, but not necessarily the typical allergic rhinitis that people associate with the word allergies. They're caused by hypersensitivity of the immune system to typically harmless substances in the environment. I'm just going to read this and then I'll elaborate. These diseases include, but aren't limited to, hay fever, food allergies, atopic dermatitis, asthma, and anaphylaxis. So essentially what's happening is the autonomic nervous system is overreactive, and for some reason the immune system decides that it's going to start attacking things that it normally wouldn't attack. These things typically cause watery eyes, itchy eyes, sneezing, coughing, dry throat, fatigue, headaches. Those are the typical symptoms that you think of. But there are a lot, as we'll go into as the slides go on, there are a lot of illnesses that stem from allergies that don't typically get associated with allergies by the average person. Atopic dermatitis is kind of like eczema, where you come into contact with something and then you get a rash or a skin illness or a skin disease like psoriasis. But atopic dermatitis itself is just the describing the skin being inflamed. So contact dermatitis would be where you actually come into contact with something, you touch it, and then you get a rash. Asthma is part of the atopic triad, where that includes like allergies, allergic rhinitis, eczema, and then asthma. And asthma is generally either exercise induced or related somehow to an allergic trigger. That it just happens to recruit different types of chemicals that the body releases that involve the lungs. And then of course there's anaphylaxis, which is the most extreme form of allergies. So the underlying mechanism of a common allergy involves IgE, which is the immediate reaction, that can induce anaphylaxis on the larger scale, and then it can also just cause allergic rhinitis or maybe some shortness of breath or some mild symptoms. So when we do testing, we usually will test for several different types of antibodies, because even though with a common allergy, IgE is what we measure in the blood, or what that is released, that releases the histamine from the mast cells or the basophils. But people can get the same symptoms as what is caused by IgE with releases of IgG, IgA, or IgM. So IgE is part of the body's immune system, along with many other types of immunoglobulins. Ig stands for immunoglobulin. The allergen is floating around in the bloodstream, and then IgE comes and binds to the allergen, and then it binds to a receptor on the mast cells or basophils, where it triggers the release of histamine. With food allergies, a lot of times people will get this type of reaction, and they can take an enzyme that will help to decrease the histamine release. If it continues unchecked for a long time, you can get what's called mast cell activation syndrome, where the mast cells are constantly releasing histamine, and foods that are higher in histamine will actually cause more of a reaction to everything else that you're coming in contact with. So the idea is to degrade the histamine so that the body's not in constant high alert. And then other allergic responses that follow a different pathway involve neutrophils, which are the white blood cells that come into attack when someone has an infection. And that is why it often triggers autoimmune conditions, because the body thinks that there is some kind of infection, there's something going on, and so it involves a leukotriene release, which is the same thing that happens in asthma, but that in asthma it's released from a different type of antibody, or a white blood cell called an eosinophil. On the sorry, back here, this is just a show. It shows that people who have latex allergies often have cross-reactivity with these foods up here. And then there are other foods as well that can cause issues with when you have a latex sensitivity. Not all people react to these foods, but it's just something to keep in mind, that one allergy can often predispose you to cross reactions with other things. Some allergy history. Clemens von Perquet, a Viennese doctor, coined the term allergy in 1906 after observing the hypersensitivity of his patients to typically harmless substances such as specific foods, pollen, or dust. Our understanding of allergies made a leap in the 1950s with the discovery of mast cells. And these are found in some of the most sensitive parts of the body, including the skin, blood vessels, and respiratory system. A mast cell contains 500 to 1,500 granules, each packed with different chemicals such as histamine, although there are others, and they're designed to attack antigens. In 1967, researchers identified immunoglobulin E, which is what we just talked about, which is the antibody responsible for most allergic reactions, although there are other influencing factors like IgG that are pretty common, especially in food allergies.
Dr. Frandsen, are you sharing your slides now? I don't think we're able to see them.
Oh, no, really? Okay. Well, that's not good. Can you see me?
I can see you.
Oh, okay. So let me see. Try that again. Well, that would make a lot more sense if you actually could see everything. Hold on 1 second. Is that better?
Yeah.
Okay. Let me go from the beginning so you guys can see it. Okay. So we already talked about all this.
We did such a great job explaining. I wasn't sure. I was like, oh, we got it.
So here's the diagram I was referring to, if you could actually see it. Some high latex proteins. So basically, if you have a latex allergy, these foods across the top can cause issues. Not always, but just something to keep in mind. If you eat any of these and you know you have a latex sensitivity, then that might be not the best option for you. And there's other things listed here, but obviously, if someone were going to have a consultation with me, I would go through all of these and give them some guidance as to what to stay away from. Can you see it even though my screen's like, can you see the whole thing? Okay. So this is just some allergy history. As far as allergy epidemiology goes, allergic disorders have increased in developed and developing countries over the past 30 years. It's estimated that a minimum of 20% of people in the US have allergic rhinitis, asthma, or dermatitis, with honestly probably more like 50% for environmental allergies and any of those symptoms like allergic rhinitis and asthma. And then at least 20% have at least one food allergy. And today, allergies are the 6th leading cause of chronic illness in the US, costing around $18 billion a year. That's not even, mentioning other countries that are developed or developing. The allergy rates in less developed, underdeveloped countries, third world countries, are negligible. I suspect, and I think a lot of allergy experts would suspect, that it's because of the things that we have in our foods. One, we're tilling soil that is not as nutrient dense, so that kind of strips the body's ability to process things if it's not getting the nutrients that it needs. Also, we're using a lot of antibiotics and a lot of chemicals in the feed for the animals that we consume, and same with the crops that we consume. I know glyphosate is kind of become part of the genetically modified wheat that we have in our country, whereas in a lot of other countries we don't see those same issues. People that say that they have reactions to it here can go to Italy or go to France and not suffer from any stomach problems or any other allergy symptoms at all. So I suspect that, just the overuse of antibiotics in our foods, and as we're sick. I know a lot of doctors will prescribe an antibiotic for a virus, which does nothing but wipe out the good gut flora. So we have no protective mechanism, and so the body will release all of these white blood cells to try and attack something that it shouldn't be attacking. So I mentioned earlier the atopic triad and other allergic responses. Allergic rhinitis, asthma, and eczema are all part of that atopic triad. You generally see that more prevalently in pediatrics and children. Part of that could be because they're not getting, they're not breastfed. If they didn't have a vaginal birth, it increases their chances of developing allergies. And then, if they're having formula every day, and they have a dairy sensitivity, either from mom or just because their microbiome is not ready to tolerate that yet, they'll develop skin allergies. Autoimmune conditions, all of these that I mentioned, plus more, psoriasis, Hashimoto's, Graves, rheumatoid arthritis, lupus, Sjogren's, celiac, IBS. And with IBS, it includes any inflammatory bowel disorders like Crohn's or ulcerative colitis. All of these things can be triggered by allergies. Fatigue is another response to allergies, headaches and migraines. I always tell a story about how we used to have family dinners. My dad would eat a whole bunch of stuff because he wouldn't eat all day. And he'd come home from work and just like gorge himself on chicken or corn or mashed potatoes or whatever Midwestern diet we had at the time. And he would get these horrible migraines. I mean, it would ruin like every holiday because everybody was just listening to him in agony. And then I kept telling him, you have an abdominal migraine. It's coming from food allergies. And he thought he was way too tough for allergies and didn't want to hear it. And then I ended up doing an allergy test on him and figuring out what foods triggered it, and then treated it with the oral allergy serums. And he is able to eat those foods now and doesn't get migraines anymore. But it only took him 10 years to believe me. So hopefully you guys don't feel the same way. So it can also, allergies can cause weight changes. There's a book that I really like. It's called Your Hidden Food Allergies Are Making You Fat. I know that's probably a frowned upon term these days, but it was written 10 years ago. But it's been a topic of concern for a long time and a topic of focus for allergy experts, because, you know, people will get inflamed when they consume foods or they're exposed to things like molds or things they're allergic to. And the inflammation in the body can actually increase weight. Irritability, depression, and anxiety, those are symptoms that people deal with all the time and would never correlate with allergies, but just that constant irritation on your nervous system can definitely cause mental and emotional symptoms as well. Brain fog, memory issues. I don't know if anybody on here suffers from pollen allergies or seasonal allergies, but I know that when the pollens are really high during like the Japanese cherry blossoms blooming and, you know, dogwoods, things like that, a lot of people say that they just feel very heavy and they can't think. They feel like they're in a fog. And also fatigue goes in with that too. And that's a response generally to like molds in the fall or pollens in the spring. Hair loss. Again, when your body is looking for things to attack, sometimes it'll get the wrong thing, and the hair follicle might be one of the casualties of that. So that can create some issues with hair loss too. Insulin resistance and metabolic syndrome. If your body's constantly under stress, and, you know, because it's being exposed to things that it's reactive to all the time, it can actually cause the body to not listen to the insulin output. So when glucose is circulating, the insulin's output from the pancreas, but it's not being heated. It's just kind of falling on deaf ears by the immune system. Hives, skin manifestations, you know, you can attest to that. If, you know, you get poison ivy or some kind of contact dermatitis, you can get hives and welts. Other skin manifestations would include like psoriasis, eczema, itching, like what they would call an idiopathic pruritus, where you just don't know where it's coming from, but typically there is a cause when something is supposedly unknown. GI disorders. It usually covers food allergies, but I've seen environmental allergies cause GI issues as well, especially molds and specifically GI molds. So there are certain symbiotic things that live on our skin and in our guts, and we can actually become reactive to that. So sometimes you have to do a whole, and I'll go over treatment options later, but you would have to tone down the nervous system response and then repair the GI health and get rid of the allergies all in one to really have a complete resolution. And then of course there's anaphylaxis, where, you know, somebody cannot breathe. Common allergy triggers. I thought this was interesting. So as early as the 1st century AD, the Roman philosopher Lucretius had noted that what is food to one man is a bitter poison to others. So even, you know, thousands of years ago, they suspected that food allergies were a thing. The mainstream medical community is still struggling with that concept, but, you know, we're getting there. So I think, you know, it's been around for a really long time, and even though the rates have increased exponentially, it was still prevalent back then. Animal dander, pollens, molds, other plants that contain volatile oils like poison ivy, poison sumac. Medications, a lot of people have, a common one is, terrible this, a common one is penicillin allergies. I think that's because it's a type of mold. It's, you know, reduced from a type of mold, and a lot of people have mold allergies, but there are plenty of other medications that people react to as well. Dust mites, insect bites, venoms, chemicals, metals, and then, like I said, latex. So if you have a latex allergy, or you suspect that you have a latex allergy, you might want to try eliminating some of these foods and see if it helps reduce some inflammation that you're experiencing. Some less understood allergy triggers. I think this is probably where people will be a little more interested in the topic. So things like infections. So some of the ones I've listed here: Candida, Lyme disease, parasites, SIBO, and Epstein-Barr virus, and other viruses. Those can actually trigger people to become allergic to things that they never realized they were allergic to before, or were not allergic to before. That's because it creates so much inflammation in your body that it can create some gut permeability. And, over on the other side, I mentioned that leaky gut could be present, and Candida is notorious for causing that. Parasites actually trick the autonomic nervous system into thinking that something else is wrong. So it starts attacking everything else. The reason is that parasites can actually trigger leukotriene and histamine release from eosinophils. So if you do a blood test, like a CBC, and you see high eosinophil levels, it usually means either parasites or allergies. So they're kind of one and the same as far as like just interpreting the data. Lyme disease, that will pretty much wreak havoc on everybody's body, until we figure out what's going on and fix it. You can treat allergies, but until we rule that out, I think it's kind of an uphill battle. The Lone Star tick, which is not necessarily the most prevalent tick that causes Lyme disease, does cause beef allergies if you're bitten. So I thought that was kind of an interesting one. Lyme disease can cause all kinds of food allergies, not just beef allergies. But stress is a big one. Anybody that is experiencing chronic stress can be susceptible to developing new allergies, just because the nervous system is so ramped up that it just starts. It's almost like, if a 2-year-old wants candy and you say no, he just starts yelling about everything and throwing a tantrum. That's sort of what stress can cause in the body. It just gets the autonomic nervous system flared up, and then it just doesn't know when to stop. You have to put it down for a nap. Toxic overload, that's just basically irritants building up in your bloodstream and in your body and your tissues. And then all of a sudden, again, your body's looking for the culprit, and it just turns to whatever it's commonly encountering. Sugar is very inflammatory. It also feeds candida. And so that's kind of a vicious cycle where the inflammation in the gut grows, and the 90% of your serotonin is made in your gut. So that when you're feeding it sugar, it kind of associates happiness and the serotonin production with sugar intake. So it's really hard to break that cycle, but sugar is extremely bad for people with allergies or people who have other things in conjunction with the sugar intake. So repetitive consumption of foods when leaky gut is present. So there's tight junctions in your guts, your GI cells and colon cells, and then they're supposed to fit like this. But when there's a lot of inflammation and there's more white blood cells being brought to the area, it just sort of starts to open up like that over time. And then all those proteins from the foods that you're consuming or from the things that you're taking, like the nutritional supplements, can kind of leak out, and then the immune system is under surveillance and finds those. Vitamin deficiencies can also trigger allergies. Vitamin C, vitamin D are the big ones. So those are, vitamin D is the pro-hormone of your immune system, and then vitamin C, I'm sure everybody's aware that that's like the one that you take when you're sick. So it just helps the immune system to kind of keep going. If you don't have those things, then the immune system goes awry. Alcohol, it turns into sugar. So those things go hand in hand, but then also there's plenty of people that have alcohol allergies that they're not aware of, or alcohol sensitivities. So that creates even more inflammation than just the process from consuming the alcohol, where it breaks down the sugars. Let's see. I put this here because there was a picture of some people I did not know. So it doesn't really fit with the slide, but it's interesting. So when people are diagnosed with ragweed, they're more likely to develop oral allergy syndrome, where you eat something, you get a swollen tongue, either swelling in the esophagus and in the throat. And these are some foods that will exacerbate that. Cantaloupe, banana, zucchini, mango, milk, mint, and lettuce. So I don't know about you, but before I actually, read all of this, I never would have put all of these things together in one category. So just something to be mindful of. Even if you don't do a full food allergy panel, sometimes doing things like latex, ragweed, environmental allergies, dog dander, cat dander can tell you a lot about what foods are ideal for you. Some treatment options. Oral immunotherapy and desensitization involves once a week treatment. So they take their drops that taste good. They're easy to remember because they come with a log, and they basically include homeopathic doses at first of all of the things that you're allergic to in several vials. So you would take 1 drop of each vial 1 week, 2 drops of each vial the next week, and you titrate up that way until you get to 5 drops of the environmentals or 6 drops of the foods, and then that's your maintenance dose. So each round lasts about 10 weeks. And then you would get a stronger dose, so the concentration goes up each time. So you're basically able to tolerate more and more without tripping the nervous system surveillance system. Sublingual immunotherapy is similar to the oral immunotherapy. It's taken every day, and a lot of times they'll put them in pellet forms, and they take a little bit longer to work than the oral immunotherapy, but people still like those. They still work. So low-dose allergen administration is basically, it's similar to the oral immunotherapy, but you can give it in injections or you can give it as oral drops, and they are coupled with beta glucuronidase to help the body to kind of wake up and see the allergen. Healing the gut is another big one. So I will normally pick, one of these 3, and then I'll do all the things down here too. So healing the gut would involve removing the triggers. So if it's food allergies, stop eating the foods. Depending on how bad the reaction is, you don't always have to completely remove the foods, but you would, just want to reduce the amount of time that the immune system sees it. So maybe no more than once a week or twice a week. And healing the gut with herbs, I usually use like L-glutamine or slippery elm and various other herbs. But a big part of that is treating the infection. So these 3 kind of go hand in hand. In order to heal the gut, you have to remove the triggers and the infections as well. And then these other options and some of these down here, will work better and faster if you're doing a top-down approach. So treating the infection, again, figure out what the infection is and then get rid of it and simultaneously calm down the nervous system response. You can do that with neural retraining. You can do that with oral immunotherapy. You can do that with some supplements that calm down the nervous system. When I'm saying supplements here, I typically will include like a L-theanine or some kind of a nervous system calmer. Skullcap you have to be careful with because it's an herb and some people can be reactive to it, but we just have to figure out what the allergy is and what you can tolerate. And then medications that usually would include, if you have asthma, an inhaler is needed, and then maybe an over-the-counter. That's typically what is used. If you have eczema, psoriasis, lichen planus, anything that's topical or that's skin related or mucosal related, those would be a little bit different. Neural retraining involves things like desensitization with tapping, trying to calm down your stress level before you encounter a certain pathogen. So an example of that would be like if you have a mold allergy or a mold sensitivity, and you go into like a big box store where they notoriously have boxes of, that have gotten wet and they have mold, and it's just, people that have severe mold sensitivity or mycotoxin illness will not feel great when they go into those stores. If you can try to go into somewhere like that where you're reactive, and you take a deep breath and you maybe do some tapping or some meditation before, it actually reduces the reactivity that you have to the allergen. I've just wrote down the treatment of various types of allergies. Allergic rhinitis, like I was saying, you can use a combination of over-the-counter meds, supplements, oral immunotherapy, avoid the allergies. And then these are some of the commonly used supplements for all of these things, all of these allergies. This is not an exact prescription, so don't just take my, this and go treat yourself. But typically these are safe ranges. And all or any of these are beneficial. I particularly like the Lactobacillus rhamnosus for food allergies because a lot of people are deficient in this, and it's a very forgiving probiotic. So you can, you don't need as much for it to populate because it's hardy, and it's not typically going to grow in the wrong part of the GI tract, like, to cause SIBO or some of the other ones. Autoimmune conditions, obviously eliminate the inflammatory triggers such as infections, avoid the allergies. Anti-inflammatory meds can be warranted if the autoimmune condition's been going on for a long time and the person is just debilitated, so you could use prescription meds, but you can also use supplements like curcumin, boswellia, frankincense is boswellia. And then that brings me down to asthma. So you can use prescription medications for asthma as well, but then lung herbs and boswellia are great additions in addition to all this stuff over here. And then for histamine disorders, there's a whole neural retraining approach that needs to happen with histamine disorders, but just as a kind of layperson's guide, a DAO histaminase can be taken before meals, like 20 to 30 minutes before meals, to help calm down the body's response to histamine and to degrade the histamine that's floating around in the bloodstream. Like I said, vitamin D is the prohormone of the immune system. And I think that the prevalence of allergies in developed countries coincides with vitamin D levels being low. So when people started hiding in their houses more, not getting out in the sun, the vitamin D levels declined because the skin, being in the sun for 20 minutes can make 20,000 IUs of vitamin D. So when people stop doing that, especially people that are up in the northern regions of our country, then the allergy levels the allergy incidences went up. So there's a lot of studies on that. I have some in the references section. Nat mirrors a homeopathic that you can take. So homeopath, I don't know how much everyone knows about homeopathics, but they're pretty neat because it can treat many things at once. The keynote for Nat mirror or Natrum muriaticum is like a chronic sadness. That's like the hallmark feature, but you can also use it in lower doses like the 200C for chronic allergies. So I will use that in some cases, especially with kids. Oh, liposomal glutathione is the master antioxidant of the liver. So with people who have a lot of toxic exposure, taking some glutathione will help sort of reduce that load. So if you think of your body as a cup, and toxins, and then stress, and then sugar, and then alcohol, all that fills the cup up, and then it starts to kind of overflow. That's the allergic response. The glutathione will actually bring it down a little bit, so the overflow is not as pronounced. Okay, here's some of the references. You guys are welcome to, I don't know if you get copies of this or what, but these are some interesting articles on the things that I mentioned before. So I can talk a little bit about, just general allergy triggers, but I was thinking maybe we could do questions because those usually end up going over, and then that'll probably take us down a rabbit hole. So do you want to open it up, Angela, or?
Yeah, sure. If anyone has any questions at this time, you could just use your raise hand feature and go ahead, and Dr. Frandsen will call on you and you can unmute yourself. You don't have to be shy. If you have a question, feel free to ask.
I'm going to stop my sharing. There we go. Okay. Okay. Well, nobody has any questions. That's different. So
looks like, are you guys raising your hand there, Naya? Here. You have a question there? You have to unmute yourself to ask there.
Hi, thank you very much, Dr. Frandsen. That was very informative. I had a question in terms of allergies that you see triggered by diseases like Lyme disease. And the question was, if you see the allergies go away with the treatment of Lyme disease, or does once the body start in that reactive process, then you will still have to treat for the allergy after Lyme disease has been treated?
So if they're IgE allergies, meaning that we do a blood test and, the IgE is the form, like it's a true allergy and not just a sensitivity. I've seen those persist. The sensitivities will generally get better as you treat the Lyme, especially if there were none there before the Lyme. So basically, as you're calming down the immune system response to the Lyme, then it's not looking for other invaders quite as much. I've also seen patients that have developed sensitivities and allergies to Lyme, and until we do neural retraining and desensitization, the numbers are still there when we test them. They feel better because that cup's not, running over, but number wise, yeah, they're still technically reactive. So.
Thank you.
No problem. There's other co-infections of Lyme, like Babesia and Bartonella, that make it worse. So depending on the number of co-infections, that kind of flares up the immune system more or less, and it can increase the severity and reaction to things.
Great, thank you so much. Did anyone else have any questions?
So
Will
I
there
don't
be a
know.
recording or a transcript? Sorry, interrupt.
No, it's okay. Go ahead.
Is there going to be a recording or a transcript? I got in late.
Yep, we will have a recording.
Okay, thank you. That was excellent, the part I heard.
Which part did you come in at?
About 15 minutes ago.
Okay.
I got a lot of them.
So I basically just went over, the history of allergies and the epidemiology, just talking about how, the prevalence of allergies has increased over the last 30 years exponentially. So from probably about 10% of people to almost 50% of people have at least one type of allergy. And when I say allergy, I mean like actual IgE allergy. Their sensitivities are a totally different story, and that I would assume that is well beyond IgE reactions to allergies. So sensitivities can be checked either through, a lot of doctors don't like the finger stick method, but I find that it matches up with a lot of the other testing that I do. So you can do finger stick, or you can do blood draws, and that'll test for, up to 196 foods with those. And that'll tell me like whether the person's hypersensitive or whether they're actually allergic, or, is it both? And some people who have IgG sensitivities are actually more reactive and have more pronounced symptoms than people who have IgE sensitivities. Like I have a lot of patients that have shrimp allergies that come up as an IgE, and it's not on their IgG list, and they have no reaction whatsoever. And then, I have people that have, like, for instance, milk on their IgG list, and they, they're extremely constipated, they get eczema, they get all kinds of different GI issues. So it's just, everybody's a little bit different, and the type of antibody will actually change, how you're reacting. I think somebody had a question about how diet affected eczema. So eczema is a huge example of how food allergies can affect, what the skin does or what the body does. So a lot of babies, again, that have eczema either have dairy allergies, or their parent has introduced a food too soon or too complex for their immune system and their nutrition, their GI tract to digest. So they'll develop reactions to it, and then that can create some permeability in the gut, even in little babies, and that precedes a lot of other food allergy developments. So with eczema, you'd want to definitely work on, normally there's a gut issue, so you want to heal up the gut, and you'd want to find your food triggers and eliminate those. And then environmental triggers actually can make food allergies worse and create gut inflammation too. So one of the things that a lot of allergists don't test for is metal allergy and chemical allergy. So people who are constantly exposed to chemicals on foods, or, you know, they're wearing nickel jewelry, or they're eating foods with a lot of nickel in them, they can actually develop an increasing sensitivity or an allergy to it over time. And it's kind of neat. We're just at the tip of the iceberg with, you know, what we know about cross reactivity. But I had one patient in specific that had a nickel allergy, and she could not eat any foods that were above like a 0.02 millimole content of, you know, being touched with something that had cross reacted with nickel. So she had to eliminate all foods that were even remotely high in nickel, and, you know, get rid of nickel. And then we over time desensitized her with the allergy drops, and she's okay now. But it was a kind of rough year for her. But you never, I mean, she went to allergist after allergist, and they just never thought that the foods that she was consuming would be the issue. So diet's very important. You have a question? You can unmute yourself. I can't hear you.
I'm so used to muting so quickly. You never know what's going to happen in my house. So I've had 2 scratch tests with about 5 or 6 years apart.
Mm-hmm.
Does that ever change? You know,
Mm-hmm. Yeah, absolutely.
really?
I have one patient that I'm thinking of. He's 7 now. He went to the allergist when he was 4 with a severe peanut allergy, like anaphylaxis, if he were even come in a room with peanut dust. And they kept doing the skin prick testing to test him. I was like, why don't we do the blood test? Because, you know, as he's getting older, he's able to tolerate those, and it's a lot less traumatic for his body in the long run. You know, instead of introducing all those substances. And so they, for some reason, their allergist was just hell-bent on keeping that skin prick test as their method of testing. So we did the allergy desensitization and worked on his gut. And then the next 2 to 3 months, it showed like it went from a 4 to a 1 as far as the scale goes. And then eventually it didn't show up on the skin prick testing at all after about a year.
But
So
you did something in between to change that. I haven't done anything like that. And I'm just wondering if the tests that are like being allergic to oaks,
Mhm.
oak trees and all kinds of things are the same. So I just wondered if maybe you outgrow them. I mean, I'm a little bit past the point of a 7-year-old. So if you don't do any interventions, can they just change?
Well, something changes. You just may not realize that something's changed. So maybe your stress is really high, or, you know, you're in an environment like your house is made of something that is emitting chemicals, like you just got new carpet and you're reacting to the carpet, and, you know, that creates issues with the rest of your immune system. And then you get out of that environment, then there's a decrease in stress there. And so life's always changing, and your immune system's always changing. Maybe your vitamin D levels go up, maybe you're, you know, eating more fruit, you're getting more vitamin C, and it's helping. You know, it's you change so much you don't even realize it. But basically the biggest thing is, you know, if you're stressed, keep your stress level pretty low, and you're eating responsibly, like your immune system can calm down, and eventually those can go away. You don't necessarily outgrow them. They're just not bothering your body as much. And sometimes, like, I have a lot of patients that say, I used to have seasonal allergies when I was young, but they're gone now. I outgrew them. Like, but you're coming to me for headaches, and you're coming to me for, you know, joint pain, and you're coming to me for skin issues. So you didn't outgrow the allergy. It just manifested itself in a way that maybe you'll listen to. So if people don't do anything to change what's going on in their terrain, in their body, then the body kind of makes up new alarm systems. So some people, you know, they could get skin issues, they could get headaches, they could get anything on its own, but if they gain weight, they freak out and then they get help. You know, or maybe there's no other issue, but then they get a headache and they can't take it. So it's, your body's just kind of crafty that way. Your immune system's funny that way. I got another question. You're welcome. Hope that help. Let's see. Kevin says, if a person is allergic to some food like an egg when they're young, is there, hold on, this part of it's cut off. Is there a way or technique that can eliminate that allergy? Yes. Yeah, you can do neural retraining, various tapping exercises. You can, I have a lot of patients that have IgE, like high IgE levels to egg or to peanut or to milk. And we do the allergy drops, oral allergy desensitization. And the FDA is actually studying that right now in like a more crude dose. So it's a little more harsh for the body, but there's a lot of different, I'm kind of going off on tangents here, sorry. So there's a lot of different ways that you can do it. My favorite is the oral allergy drops because you only have to do them once a week and they taste good and it's easy. But that just involves introducing a very small homeopathic dose of the egg to the immune system, and then by default the nervous system, and they eventually don't have a reaction anymore. But I would say with foods, I mean, you have to look at the gut, and you don't necessarily have to do a stool test. You can just, if I get a food allergy result back and 20 out of 20 are positive, then that indicates that there's some kind of gut permeability and likely some infection in the GI tract, because nobody really has that many allergies. There's something else going on. Does that help? So I think the bottom line is pretty much with any chronic illness that's usually multifactorial. And I think that making sure that you cover all the bases will help the most. But allergies are very tricky because they're more of a new phenomenon as far as like the chronicity of it. So people don't really understand it. If it's not itchy, watery eyes, coughing, sneezing, they don't think of it as an allergy. But I have somebody close to me actually that was diagnosed with Sjogren's syndrome, and we found that she had mold in her home and had for several years. And then when she got rid of the mold and we did the desensitization for it, the numbers went back into normal range for the ANA. So allergies can really, cause a wide array of symptoms. And I think that, if you're looking at infections and allergies and toxicity and all that as a kind of a feedback loop, it's sort of like when you're if you look at the cell cycle, there's G0, which is like entry, and you just have to find the G0 point in that cycle and just disrupt it somewhere. So either start treating the infections or do the desensitization, or, start working on the stress. If you start somewhere, everything starts to improve, because if you fix the allergies and you have Lyme disease, then the immune system can start to concentrate on the Lyme disease and not the allergies, because the allergies are basically a smokescreen for the Lyme. Epstein-Barr virus is a big one that does that too. That one I find is often associated with Hashimoto's or thyroid issues. And if you, another thing with Hashimoto's is that a lot of people have reactions to wheat, because wheat is part of bromide, which is a lot of things that have wheat in them are enriched with bromide. And bromide is on the periodic table of elements is a halide, which is in the same family as iodine. And iodine is part of the thyroid. So if you're eating a lot of enriched wheat products, that can displace the iodine, and then it can wreak havoc on the thyroid. So whether you have a wheat allergy or not, that food should be eliminated if you have Hashimoto's, at least for the first year, to make sure that that's not influencing it. Then, simultaneously, you can look at Epstein-Barr virus, which often triggers Hashimoto's as well. And then once Epstein-Barr virus is in your body, that's a very stealthy pathogen, kind of like Lyme. It's a virus, it's not a bacteria like Lyme, but they're both just very good evaders of the immune system. And so once those come on board, all of a sudden, all the surveillance systems are up for the immune system. And that's when you start developing a lot of allergies. Problem with Epstein-Barr virus is because it's a virus, you don't ever really get rid of it. It just goes dormant. So you can work to get it into dormant phase, and then, just keep an eye out for recurrence of allergies or recurrence of fatigue, and just check it to see if there's like a flare up or an early antigen that pops up in blood work. So there's definitely a lot of nuances that go along with allergies. It's not just, okay, I have this and now I take a Claritin and it's gone. Yes, that might stop the symptom at the time, if it even does, but your body's going to try to tell you something's wrong in another way. So that's why people come in and, they have all kinds of obscure symptoms. And when I mention allergies, they're like, no, but I don't have allergies. And then we test, and all of a sudden, they have 20 things pop up. So it gives me a lot of information. Let's see. If you move into a brand new house and don't know if you will have any reactions to anything in the new house, is there anything you can do, test or otherwise, to protect yourself and others in the house? Well, yeah. I mean, first of all, you can do mold testing, before you move into a house. Sometimes if you hire somebody from a mold like a mold remediation company, they'll use just air samples and they won't find it. I like a test called ERMI testing. So it's environmental environmental relative moldiness index. That's what it stands for, ERMI. And you can get it on mycometrics.com, even though I'm not supposed to give out any details. But they give you these, what they call AccuCloths, and you wipe the windowsills or you wipe vents, and you send it off and they'll tell you what your score is. And if it's over a 2, then there might be an issue. There probably is an issue. So that's one way. Obviously, if you know that you're a very sensitive person, if you have something like brand new carpet, there's a lot, and brand new furniture has a lot of outgassing. You could put air filters in the house. You can actually wipe it down with something like activated charcoal powder to help draw out some of that off-gassing. Just let it air out. You could open the windows and as long as you don't have a lot of seasonal allergies, you can let the off-gassing go out into the open air. But a lot of people unfortunately don't realize that they're going to have a reaction until they do. And it may take, if you're not a super sensitive person, it could take a year, before that happens. Actually had a patient last year that moved into a home with old carpet, not new carpet. And they got it steam cleaned a couple of times, and the dust mites were so bad that he actually ended up having kidney issues. And you would never think of kidney issues as an allergic response to anything. But he got rid of the carpet, and we did some binders, and then, over the course, and desensitization. And then over the course of the next 6 months, his numbers were all back to normal. He felt fine. But you just never know who's going to react to what and how much. And I find that a lot of people who have Lyme won't realize that they have Lyme or Epstein-Barr until, you have this straw that broke the camel's back kind of reaction. So, they might have Lyme, and then they're stressed out because of grad school, and then they get pregnant, and then all of a sudden they're sick. And they attribute it to the last thing that happened, when you really have to walk it back as like the cup ran over sort of thing. I'm kind of got off track. I don't even remember what I was saying now. And another question popped up, so I'm going to answer that. Regarding iodine, I'm hypothyroid, and I hear totally opposite things about whether you need iodine or should avoid it like the plague. So it depends. If there's Hashimoto's, then you need to be careful. There's some schools, some camps that think that iodine's okay for Hashimoto's, and some that think that it isn't. I have actually had totally mixed results on all that. If you're avoiding wheat and you're being very strict about, the allergies that you're consuming, there's no other issues other than just regular hypothyroidism, I think iodine is fine, especially if your levels are low. And a lot of people are deficient in iodine, especially, with iodized salt being shunned these days. But if it's Hashimoto's, I would say you would I would do a localized topical application and figure out, how you feel, because you're not going to have as much of a response to that, like as much of a reaction. Does that help. No Hashis or gluten. Okay, so you don't eat gluten and you don't have Hashimoto's. I think iodine would probably be fine. Now, again, I haven't tested you. I don't know your history for sure, but if you do like a blood spot test through a company like ZRT or Genova or something like that, they can actually do an intracellular level and tell you whether or not you're iodine deficient. And if you are, you should absolutely supplement with it, or at least eat foods like seaweed or things that are higher in iodine. Let's see, no other questions here. Oh, yes. Oh, thanks, guys. Like I said, if you guys want to look at any of those articles with the references, I shared them. Some of it is out of order, but if you ever need to know where I pull the information from, I'm happy to pass it along. So.
And we will be posting a recording of this on YouTube, and so make sure everyone will have access to that as well. So.
Okay, well, thank you. I'm a little bit rusty, so hopefully I'll make some more of these and it'll go a little smoother.
Yeah, thank you so much, everyone, for joining, and thank you so much, Dr. Frandsen, for the presentation, and we hope you all join us next time.